Do you have questions about whether your child or client with autism or signs of autism should be on medication? Today, we are talking about some of the top questions we get about medication. Hi there, I'm Dr. Mary Barbera, autism mom, behavior analyst, and bestselling author. Each week, I provide you with a video or two about turning things around. So if you haven't subscribed to my YouTube channel, you can do that now. So today we are sharing a small excerpt from podcast number 181, where Kelsey General and I talk about some of the top questions we get about medication. So the short answer is no. Back when Lucas was diagnosed in 1999, we asked Dr. James Copeland, who we've done a podcast with. We can drop that in the show notes. We asked Dr. Copeland, is there a medication? Because I'm a nurse and my husband's a physician. And so we come from a very medical background. And Dr. Copeland, I remember it clearly, said, we do use medications for kids with autism, but only after a good behavioral program is in place, only after we really see what he's going to do with ABA therapy, applied behavior analysis therapy, which was back then and still is the most proven treatment for children with autism. I know there's some controversy about ABA, and I did a podcast on the 4 myths and truths about ABA from my perspective. We can link that in the show notes as well. So, and then the other thing Dr. Copeland said, and again, this was years ago, was that there's not a specific medication for autism. There's medication that treats symptoms that some kids with autism face, like there's medications for sleep, there's medications for aggression, there's medications for anxiety or depression. There's medications for obsessive compulsive behavior and those sorts of things. So unless you know what you're treating, which the only way you can really know what symptom you're treating is by doing an assessment and doing a plan and trying to teach without medication to get a baseline. Like, we need to really think about, first, we have to do all of the things that I preach every single day, and you do too, Kelsey. So no, there's not a specific medication for autism. There are some that are more commonly used, like risperidone and Abilify are 2 of the top ones that I've seen prescribed. But it's that's kind of my answer. I don't know if you have anything to add.
Yeah, I mean, that would be the same thing I would add. I know a lot of kids who end up getting prescribed ADHD medication, or again, anti-anxiety medication like Prozac or fluoxetine type stuff. And then there's medication, like you said, which is technically an antipsychotic, which is risperidone and Abilify. And a lot of the times we see those given to kids who have high problem behaviors. But there's not a lot of, it's so tricky because, again, like you said, Mary, it's so much depends on what you're trying to treat. And at the end of the day, if a child's aggression is helped by medication, you may be able to teach more, which then can help their autism and their symptoms of autism. And if they're not learning because they have such high symptoms of ADHD, it can help that way. But like you said, having a good behavioral program in place and having other good supports in place is really how you're going to help medication work to its fullest extent.
Right. Like even 2 episodes ago, on episode 179, we talked about sleep and how, like melatonin might be used, but it might, if you're not taking some kind of data like calendar data, it may actually backfire and do the wrong things. I know for Lucas a lot, we probably tried 12 medications when he was younger, and I had no record. I didn't know how old he was, what we were treating, what the dosage was, why we got off of it, what side effects were. I mean, I have no idea because I did not have my calendar system, which I am a big fan of. So basically the calendar system is you get a physical calendar, not an electronic one. In the front of ours, we usually have a pencil and a red pen. And the pencil is used for staffing changes or those sorts of things for therapy. And then the red pen is used for any kind of medical issue. Sometimes kids with sleep problems, we can put that in there. Allergy shots do, antibiotics, and behavioral issues. So unless you're really keeping track of things, I think throwing medication on a situation can make it actually worse in many cases and can backfire. I hope you enjoyed that short clip from episode number 181. If you'd like to listen to the whole episode, go to marybarbera.com/181. And if you'd like more information about joining our online course and community, you can attend a free workshop at marybarbera.com/workshop. If you like this episode, please give a thumbs up, leave a comment, or share it with somebody who might benefit. And we'll see you right here next week.